Take it away.
All right. Hi, my name is Lauren Sabatini. I'm a physical therapist here with Riverside. I've been practicing for about 5 years now and with Riverside for the last 3. In the last 6 months, I've kind of just specialized in treating patients virtually through Rehab. So I'd just like to take some time with you guys today to give you a better understanding of what telehealth or Rehab is so that we can really get to understand it. So we'll kind of take it from here. So, what is Telerehab? Essentially, it is physical therapy services provided to the patient virtually. So, the provider and the patient are not physically in the same space. We use Zoom to perform all of our Telerehab sessions. So, instead of the patient coming into the clinic, they just pull up Zoom and we get rolling that way. So, because Zoom allows video and audio capabilities, we can fully assess function, mobility. Sessions continue to be face to face, one on one with a skilled physical therapist. So that's kind of the gist of what telerehab is. So why is it important? Well, we kind of created it as a response for COVID-19 during the pandemic to help patients stay at home, limit exposure, because really the risk of contracting COVID is pretty small with masks on, but it's 0% risk if you do it at home because you don't have to come into contact with people. It's also very convenient, effective way. It's kind of again started off out of necessity, but has kind of evolved into like a revolutionary way to get physical therapy still effectively, just more convenient. So really, who can be offered telerehab? Well, any patient that's interested can be appropriate for physical therapy virtually. If you're a physician referring patients and want them to do it virtually, just set up the evaluation that way. If you're a patient that's interested, you can always have your first visit this way. And then at that visit, the therapist can decide, are you great? Are you appropriate to be treated this way? Or would you prefer to come in and be treated that way? It's kind of up to that first visit to decide where your care will go from there. We've treated all sorts of injuries with telerehab. We've treated athletes, patients with balance dysfunctions, various orthopedic injuries, ankle sprains. We've even had some post-op patients that we've seen kind of right after surgery all the way through discharge. So it really wide variety. Anyone can be appropriate to have physical therapy virtually. So just to kind of review some benefits, again, safer during COVID-19, 0% risk. Also, if you're ill, like just sick in general, have a cold, have the flu, but still want to work on back pain, shoulder dysfunction, whatever, you can still do it from the safety of your own home and not worry about, getting anybody else sick. Another big benefit is transportation. So it completely cuts down on your commute. You don't have to drive anywhere for it. If you rely on an Uber or the bus, public transportation to get to your sessions, you don't have to worry about that because you don't have to leave where you're at. Another big benefit we found is parents with children. Our waiting rooms are limited size right now, so you can't really bring family members with you. So if that's a concern, you can always stay home with your family members, do it from the safety of your own home. Same with patients with caregivers. If you need, support staff with you due to limited availability in our waiting rooms, you don't have to worry about that issue. You can do it from home. You also don't have to mask up if you're doing it from home. You don't have to worry about bringing your mask. If it's uncomfortable for you to wear, you're in the safety of your own home. You don't have to worry about that. And one of the greatest benefits we've found is it's just as effective as coming in, outcome wise and patient satisfaction wise. It's very comfortable for most, and the ease of access is really kind of its selling point. It's a really great way to get the services you need. So just to kind of review some frequently asked questions we've gotten from our patients, just want to kind of lay them all out there, the ones that we've gotten so far. So how does it work? What does virtual therapy mean? So we kind of reviewed in the first slide. It's the same thing as coming in person. It's a one-on-one session. You're still face-to-face with the therapist because it is on Zoom. The main difference is we just can't touch you. We can't put our hands on you. But that doesn't mean we don't get all the information we need to best treat you and get you improved. And then what about follow-up sessions? Well, if you ever had physical therapy before, you have your first evaluation, and then from there we make a plan. Usually see patients 2 to 3 times a week, and follow-ups are about 30 to 40 minutes. Same thing applies for telerehab. You can be seen 2 to 3 times a week, 30 to 40 minutes, just dependent on what we find at that evaluation. Instruction still one-on-one. You get the verbal and visual cueing from your therapist over Zoom because there is that video and audio. So we really can see what you're doing, and we really can correct if you're doing it incorrectly. And then does it work? A lot of patients are kind of hem and haw and say, well, I think it'd be better if I go in person, and that's totally okay. Everybody has a preference. But if you're worried that it's an issue of, I don't think I'll get better this way, really want to put that to rest, because new research and then outcomes that we've been tracking ourselves have shown great outcomes. Satisfaction is very high, and just as comparable as you coming into the clinic with improvements in your pain and in your function. And then will insurance cover it? Absolutely. So because of COVID-19, insurance companies kind of rechanged physical therapy and have now allowed it across the board. To most insurance companies allow this. If you're ever worried, you can always give your insurance company a call before you start, but most of them have allowed it now and have continued to allow it during this pandemic. Now, how do you have Rehab? We'll kind of talk to you already. We use the secure platform of Zoom. So if you have a smartphone, you just need to download the Zoom app. If you don't have a smartphone but have a laptop or a tablet, you can go to the website zoom.us, and you don't need an account. It's completely free, it's secure, and we kind of talk you through the steps on how to log on for your first appointment. And then patients often ask, well, what about equipment? I don't have stuff at home to do physical therapy. And if you've ever had physical therapy before, you know that a lot of our exercises are body weight based, and you don't need extra equipment. You don't need machines. You don't need anything like that. Occasionally with our Rehab sessions, we'll use some household objects just to help facilitate some strength goals, but we often don't even do that. We do offer TheraBand pickups, so those resistance bands to kind of give us more tools in the toolbox to help treat you. But again, those are not needed, but that is an option that we have for you. So just kind of expand on these virtual visits. Like I said before, with evaluations, because we can see you and we can hear you, we're able to assess everything that's necessary to understand why you're having pain and to be able to come up with a plan to make you feel better. So the interventions, your follow-up sessions remain just the same as in the clinic. It's face-to-face, cueing is given one-on-one. And the nice thing is, because it is one-on-one, there's nobody else around. There's no other patients that might need your therapist's attention. It's very direct. Cueing is given visually and verbally. So we're able to correct and make sure you're doing things correctly. And then patients love this option of therapy. It's convenient, and they really do improve per the results we've gotten so far. So how it works. Kind of already said this a little bit, but at your appointment time of the virtual visit, the therapist gives you a call and they talk you through the easy steps to join the meeting that the therapist has created for you. We don't send you a link ahead of time. We're not on my chart just yet, but we do. So we just call you at your appointment time, talk you through the steps. At the beginning of your session, we kind of check in on how you're doing, anything that's new. We get your location just for safety purposes, in case anything were to happen to you, since we're not in the same room. Everybody's safety, want to be able to address that. And then we start each exercise by explaining it in depth and then demonstrating to you how to do it. We watch you do it, and we watch you very closely, and then give you any verbal cues to change it if you're doing it wrong. And then we also can give you some visual cues by demonstrating what you're doing wrong, and then how to understand that we can do therapy this way. So kind of go back to the PowerPoint to just kind of recap some things. So our results, we've done some outcome measures and found that our therapist telehealth ranks in the top 75th percentile nationwide for effectively treating back pain, 98th percentile for treating knee and ankle. Patients report 86% improvements with Telerehab. They truly get better. And then majority of our patients would choose to get PT this way again. And 100% of those surveyed stated they agree or strongly agree that they met their pain and therapy goals with Telerehab. So it's pretty awesome results there, just showing that it really does work compared to coming into the clinic. We've had just as good results. So I just wanted to kind of flash some testimonials up here before we wrap it up. Many people say it's a great personal feel. Happy to have the guidance and the comfort of my own home. One of my older patients stated during PT sessions virtually turned out to be great. She makes virtual sessions as good as face-to-face therapy. Both therapists are amazing, really listen to what I need. And then another patient that was with us for a little bit after a hamstring injury, telehealth allowed me to continue with my hamstring rehab without skipping a beat. I'm extremely thankful that my PTs were able to offer an alternative solution in these trying times of the pandemic. So people have really appreciated this offer, and that's just a couple of our testimonials. We've got really great feedback from patients that didn't think it could work, but then once they had it, we're really thankful for this option. So just to kind of recap benefits, even though things are kind of starting to try to get back to normal, patient and public safety is still number one concern. So doing the best you can to stay safe and stay at home, this is a great option to do that. Ease of access, you can do it from home, you can do it from the office. Anywhere in the state of Virginia, you can be treated via Telerehab. High patient satisfaction, personal one-on-one face-to-face. Your sessions are uninterrupted. There's nobody else distracting you or distracting your therapist. It's completely one-on-one, just like our live feed here today. And then we've had really outstanding improvements in pain and function. It's been really highly effective, as we showed there with some of our results. So that's kind of all I have today. Just wanted to kind of present to you guys, and because I know it's a new thing and a lot of people don't get it, but it's really an awesome, convenient way to still get the skilled care you need. So.
All right, Lauren, thank you so much. We did have a question that just came in, and it's asking if it's beneficial for everyone, including seniors.
Yeah, so it can definitely be beneficial for everyone, including seniors. We've had a couple senior patients with medical conditions that make them not want to go out during COVID. And, first visit, we just kind of get an idea of what they need balance-wise. We review safety techniques. So if there's an issue with balance, we get your location just in case something were to happen. But we also give you cueing to make sure that you're safe while you're doing your exercises. And our patients have really gotten better, even the elderly, and it's super easy. If you're not technological savvy, we talk you through it. It's just a couple steps to get on, and then once we're on, it's really beneficial for everybody.
Fantastic. Well, thanks so much, Lauren, and thanks everyone for joining us today. If you were with us live, if you're watching this recorded, if you have any questions, feel free to reach out to Riverside Physical Therapy in Denby, where you can reach Lauren. Again, appreciate everybody joining, and enjoy the rest of your day.
Thank you.